Water and soil, a source of life, can also be the cause for illness and death. Neglected tropical diseases, or NTDs, are a group of communicable diseases that affect more than 1 billion people living in poverty. Yet, most of them are readily preventable and treatable. Such people do not have access to sanitation and are usually in close contact with infectious vectors and their domestic animals. In South Sudan, a very young country, health systems, including infrastructure, are still under development. This means access to healthcare is extremely limited, and the disease burden due to NTDs is high. Although many endemic countries have mapped for these diseases, South Sudan has just recently embarked on this important exercise.
This will really help us to know the magnitude of the problem, the prevalence of all the 14 neglected tropical diseases. Having this information, that will be good for the government at the national level and communities in terms of knowing where these diseases and the burden of the disease, so that we'll be able to address them from a very systematic and evidence-based information. So this will guide our decision making and will help us also to be able to appear in the map of the world, especially the region office, with regard to these neglected tropical disease.
The African region bears about half of the global burden and endemic for at least one NTD, with more than 3/4 co-endemic for at least 5 NTDs. The rate and intensity of some of the waterborne and soil-transmitted neglected tropical diseases, such as schistosomiasis or bilharzia, and soil-transmitted helminthiasis or intestinal worms, is not yet documented in some parts of the world, such as South Sudan. The government of South Sudan and its partners, including WHO, is committed to improving the health of its citizens. The main goal being ensuring the access to basic health care to the majority of its people. As part of its preparation for ensuring universal health care for its people, the government of South Sudan is increasing its technical capacity.
The lab is a key in any process, whether it's a research or a survey. Because without lab, there will be no reliable data. And that's why in this survey, I mobilize my technical group to go and participate in all the process.
Indeed, the need for proper data collection and analysis cannot be overemphasized. It is for this reason that WHO and its partners embarked on this rigorous mapping for NTDs. These diseases deprive people of their dignity and even their lives.
South Sudan has one of the biggest magnitudes and is endemic for neglected tropical diseases. WHO has been committed to addressing global burden of neglected tropical diseases in the whole world, including South Sudan, and be able to define strategies that can be put in place to support the government of South Sudan be able to respond effectively to this disease. Some of these neglected tropical diseases, they include case-managed neglected tropical diseases, and they are normally diseases like guinea sleeping sickness, Kala-Azar, brutal ulcer. All of them are prevalent in this country. The other group of neglected tropical diseases, they include preventive chemotherapy, and such includes onchocerciasis, which is normally known as river blindness. They include soil-transmitted helminth, known as intestinal worms, different kind of intestinal worms. They include lymphatic filariasis, which is known as elephantiasis.
South Sudan is the last country to be involved in this kind of mapping. The mapping exercise targeted schistosomiasis and soil-transmitted helminthiasis. The school-based mapping sampled 17,500 boys and girls aged between 10 to 14 years, while the community-based mapping sampled 14,000 adults throughout the country. The exercise began with a rigorous training of the teams involved that comprised lab technicians, data managers, and community mobilizers.
The team moves out. They go and set temporarily a laboratory setup within the school. We start now the implementation of our data collection tools. We have got some tools which are specifically for the teacher to give us a brief overview of water collection points within the community, the sanitation components they are having in the school, and then the hygiene practices in the school. There afterwards, we take the stool samples and the urine samples, and then we do our parasitological analysis. We've got 3 key major tests which we perform. We perform the stool catocars for identification of the Schistosoma mansoni, and then we do urine filtration for the identification of Schistosoma hematobium, and also we do urine dipsticks to give us the clear indication as to what might have been a cause of any blood in urine. We combine all these data so that they can give us the true prevalence of the diseases within a certain region, and also individual infection intensities.
It's an exercise that required a lot of resources, but yet still faced numerous other challenges as the teams forged on to accomplish their task.
We have had some unfortunate situations in 2013, 2016, which resulted in some insecurity in some of the areas. That is a problem. The second one is that our economic situation currently is a bit tight. So what we need is we want to have a collaboration with WHO in a much deeper sense. Of course, each of the diseases will require special attention in its own right based on the mode of transmission, prevention and treatment.
Today, WHO has been able to access 80% of the counties in this country, and there are a few that are still remaining. WHO is doing the very best together with the Ministry of Health to ensure that we will be able to access all of them and be able to measure the prevalence of these diseases.
Preliminary data indicates the presence of schistosomiasis and soil-transmitted helminthiasis within some of the communities. This is the kind of useful data that WHO and its partners were looking for.
What I'm seeing from the preliminary examination, we are seeing quite a number of positive cases, both for schistosomiasis and also for soil-transmitted helminth.
WHO believes that the findings from this mapping will be beneficial to all the stakeholders involved in the provision of health in South Sudan.
Unless treatment is given to these people affected by NTDs, we cannot, or the South Sudan cannot be able to achieve universal health coverage. WHO will work very closely with all partners, including the Ministry of Health, to make sure that all these preventable NTDs are eliminated on